Hey, good people, welcome back. This is Sharea Farmer, your resident therapist slash counselor slash social worker slash all that you need in mental health professional. Welcome back. Today, just kicking off a discussion on something that's often overlooked, but absolutely essential for social workers and mental health professionals who are licensed, which is maintaining our license. Think of it as tending the soil beneath your roots, keeping your credentials fresh, your ethics sharp, and practice strong. And so today, that's what we're going to talk about, why license maintenance matters. And you've heard me talk about this a little bit, but we're going to talk about it a little more in depth because when we think about the importance of continuing education, usually it's surrounding that license maintenance. But the reality is, our licenses help us to maintain our professional identities. There are some areas where you'll hear me talking cultural competency, oppression, and other things that may challenge some of the status quo around these requirements. But for today, we're going to talk about why is license maintenance even a thing? And here's what matters most. So the first thing is ensuring competency. For me, that matters most because continuing educations keep us up to date with research, techniques, and best practices. I also challenge that where it allows us to be able to challenge some of these up-to-date practices and be present to know what the research is saying, what who the research was performed on, and all of those different types of things that help us become better professionals, but also better practitioners. Legal and ethical compliance. Staying in good standing with your state board means you're aligned with the legal and ethical standards that you have to follow related to your NBCC and or NASW code of ethics. Client trust and safety. Our current license, our current license and maintaining our license signals to our clients that we're held accountable and that we have qualifications that make us an expert. Now, some of us argue that that shouldn't be the case, and I get it. I'm not going to go into that today. I'm just giving why license is even a thing, quote unquote, but also why we have to maintain them. Career growth is our next one. Many Many of us want to kind of advance our knowledge, advance ourselves professionally. And what continuing educations and license maintenance allows us to do is to show that we've been specializing and we've been specifically specializing in certain areas. So think about licensures as well as certifications and certificates that you might get that actually boost your expertise, but also shows your clients and the world that you're held accountable to keep that certification or licensure. And then lastly, insurance reimbursement. The truth is that if you plan to be in private practice, if you're not going to do self-pay only, oftentimes insurance companies will demand a valid license before they'll even reimburse you for payment. And so thinking about it from that perspective is that we're ensuring competency. We're ensuring legal and ethical compliance. We're showing our clients trust and safety in our expertise. It's career growth and insurance reimbursement is really part of the cycle of the system of being licensed in some ways. And so, why do we need to maintain these licenses? Here's a quick checklist for you to kind of think, and I should say not why, but what do we need to maintain these licenses? And you've heard me talk about this in the past, but just a quick checklist for you to kind of maybe write down or keep in the back of your mind as we're talking is that CEs are typically between 20 to 40 hours of our requirements every 2 years in most states. And some places they're 20 every year, depending on your state. Topic specific CEs. Many states mandate trainers in areas like ethics, culture, I should say culture and identity or cultural competency, and substance use, as well as mandatory reporting. Documentation, keeping your certificates details is extremely important. And we talked about having a tracker, but also saving the certificates in a folder. And so keep that certificate details. Make sure your certificates have on it the course name, the date, hours, and your name. And in some cases, even your state license is required on the actual on the actual certificate. And then timely renewal. Submit your application and your fees on time. That way you can get any feedback and or if you're audited, you have the time before the new cycle begins to have everything done and put away with. And then lastly, professional development. Think supervision, peer consultations, journal reading, really trying to make sure that you're constantly not just keeping the maintenance of your license, but you're also professionally developing and growing in what you do and how you do it. And for some of us, that's extremely important. For others, we just get them out the way. But for me, I really think if you are strategizing, you're learning, it allows for you to be the professional that you determine you want to be versus kind of being scattered in many ways. So who's involved in regulations and in our cases, what are the regulatory organizations that we have to even consider or be concerned about? So I can start with social work. That's our primary I guess regulatory organizations has to do state by state, but we have to be state licensed and pass an exam and standardized requirements in specific areas. And ASWB is our association that works on all of those regulatory factors based off of your state. NASW is also a second one, which offers continuing education, and it does national advocating for us as social workers to make sure that we are constantly on the forefront, not for just advocating for social workers, but for the communities that we impact. And sometimes I know NASW gets a bad rap for not doing enough or not seeing enough, but I think sometimes it's because what is happening is that we don't have a clear communication of the things that they're doing for us as social workers. And so before you challenge me, I would probably say it would be awesome for you to check, if you are a social worker, to check out the NASW policies or the policy and advocacy work that they're doing. Sometimes it's being done state to state with different things, some of the larger national compact related issues that they've been working on. And I really would love for you to just check it out so that you can know that sometimes even where you don't think anything is happening, there's constant work going on that keeps our license at a certain standard. The same can be true for our state boards and our state licensures. So you may have to know, or you should know, which commissioner slash department or division is in charge with your specific state rules and state licenses. And then there's other ones like NBCC. We talked about CSWE, which accredits our educational programs for social work and essentially is the initial licensure that is required for you to even get a license. So you want to make sure you're going to a school that is actually accredited in social work for you to be eligible to even take a licensure. Lots to think about, right? But it's more important that you know ahead of time before you take a 2-year degree or 3-year degree, excuse me, and you don't have anything to show for it as a result. So just think about making sure that you know based off of your license, be it a social worker, LPC, which is a licensed professional counselor, or a MFT, which is a marriage and family therapist, or a mental health counselor, whichever board is responsible for your regulatory needs, you need to know that board as well as how it regulates on your state level for you to get your licensure and also to maintain it. Um, Continuing education hours is something that we need in all of those areas that we talked about. So making sure that you are establishing and enhancing your skills, staying current, having ethical practice, and specializing your actual expertise so that you can be the professional that you wish to be. So deepen your tools to better serve your clients. Keep up with the evolving trends and the different types of research in your area of expertise. And make sure you're focusing on culture, identity, and ethics because all of those things are going to be continually important for all of your practice. And then specialize, specialize, specialize. For some of us, specializing just simply means, you know, I specialize in trauma, and for others, it means I specialize in culture and identity related to trauma. That would be something that I would say for on behalf of my own profession, right? Or specialty. And so really knowing how are you going to be the expert and why does this license even matter to you is going to help you move ahead. As we talk about helping you move ahead, look ahead. Telehealth therapy, mental health, or remote work is here. Learning and understanding what it looks like to do that work from an ethical and moral standpoint is going to be important. So know your standards around remote practices and how they are impacting both your clients and equitable care for some communities. Cultural competency and anti-racism and anti-oppression are important because they focus us on and being inclusive practices that offer a nourishing community and knowledge in those communities. So become aware of what you don't know and how you can grow in those areas. Tech and therapy is also another area where we want to make sure we're looking ahead with AI guided tools, with understanding data ethics, and even some of our EHR, which is our electronic health records and systems. Understanding all of these things help us to stay ahead of some of the trends of the world and our practice. And then collaborative care, more training on interprofessional networking between psych, social work, medicine, and beyond. We have to learn how to work together so that our clients can continue to get the benefit of even working with us. And so I hope that helps us. Just to kind of wrap up, keeping your license active isn't just about a bureaucracy. It's your promise to your clients, your growth, your pathway, and marketing you as integrable as well as accountable. It says, I'm here, I'm evolving, and I've got someone backing me or some larger systems backing me. Now, on different times, you may hear me talk about the oppressive, the systemic issues, and some of the other things that also dwell into our licensure. But for the purpose of maintaining and those who choose to maintain, it's important to know that it does matter that you have it if you're going to do certain types of practice and or if you're going to do it under the ethical or legal consideration for your state. And so making sure that that's just the truth and something that we're currently dealing with in our systems is not where I'm coming from. It's just coming from a perspective of keeping yourself active, knowing how to make sure you're renewing your strategies and tailoring your courses to support your journey can help you to actually offset even some of those oppressive and systemic issues that we have around maintenance of license. Thank you so much for just tuning in and listening to me rant about something that I care about. I hope that this reminds you to stay curious, stay grounded, and in some cases, stay licensed, right? Be in touch with what your community needs and how you can support it with your continuing education and your own cycle of learning. Explore some of our courses if you need to at rswellness.org. Until next time, keep doing the good and vital work, and I'll see you on the other side. Be well.